Good morning and good day, everyone, and thank you for joining. As you know, as you've seen in the announcement, this is a 1-hour webinar organized by HOPE and the Health Pros Network based at the Amsterdam University Medical Center. And this is a result of already an ongoing collaboration between HOPE and the Health Pros Network for already 2 years. This webinar, as the title shows, is called Beyond Hospital Data, and the main topic is basically the data integration or COVID-related data integration between the hospitals and the healthcare institutions in which you work in and other players in the healthcare field. So this is mostly about data, COVID, and data exchange and integration. I will let Pascal kickstart this webinar and give a short update on the HOPE activities and the exchange program activities. So we'll take a few minutes for that. So the updates from the HOPE community. Then we will present briefly the results of a very short survey that we've conducted in the past month, which I suppose a lot of you participated, and thank you for that. Then the majority of this webinar will be the panel discussion with the audience involvement. So there will be asking questions, polling, and you are free to comment at any time, either by raising your hand or through the chat box. And we'll just briefly wrap up and announce next steps and the future agenda, as we call it. So, Pascal, the floor is yours.
Thanks a lot, Damir. Welcome to you all for this first webinar of the HOPE Exchange program. Beyond hospital data. Of course, you all know, if you're there, that we had to postpone twice the HOPE Exchange program in 2020 and of course in 2021. It will take place in 2022, hopefully, and we're working on it, and hopefully the situation will work very well. In the meantime, we thought it would be nice to keep in touch with all of you. With the candidates that were expected to join the program in 2020 and the host, of course, as well as the participants of 2019, those who joined all of us in Ljubljana. We thought that having this group together working on this mini survey was a good idea to keep the contact. We got, it's very lucky, the support of the Amsterdam University Medical Centers, Nick Lazinga, Doin Kringers, who is also here with us, and of course Damir, who helped us design all of this webinar. Before leaving the floor to Nick, I inform you that the session is recorded, so this will be available later on YouTube also, because some of colleagues could not make it at this hour. Please stay muted, but we appreciate if you keep your camera on. It makes things a little bit livelier, and if it's possible, because sometimes it creates difficulty in the connection. You are very, very invited to raise questions, make comments in the chat box. So Doin Kringers is there also to pick up what could be then raised in the discussion after the panel. That's it for my side, and I leave the floor to Nick Lazinga.
Thank you, Pascal, and yeah, also good day on my behalf. It's really a pleasure to see some familiar faces that I've seen in 2019 in Ljubljana, and new ones who are in the program. Just to say that I agree with Pascal. It's good to keep this network together, but also use the opportunity, because our original idea in 2020 was to build on the workshop in Ljubljana and not only to look at the use of performance data in hospitals, but basically start to address the use of performance data beyond the hospital. So how is the link of your hospital with other institutes like public health institutes, primary care, long-term care, and other colleague hospitals? And then COVID came, but instead of postponing, we thought, why not capitalize on the situation? Because a lot of things seem to be changing through the pandemic in the interactions of hospitals with their surrounding. So that's why we thought we start this work, and this is the first webinar to pick it up. And we try to do it also in a scientific way, in the sense that we use surveys and then later on interviews to capture your experiences and then discuss with you what it actually means. So today, we hope to present to you your own answers to our survey that have to do with how you experience the interactiveness of your healthcare institutes, and most of them hospitals, with the other healthcare services in your region, and how that reflects in the way how you exchange data. So I'll give the floor to Damir, who will give the study results briefly, and then I'm very happy to discuss the results primarily with a panel of 4 of your fellow participants in the program and country coordinators. And as Damir said, if you want to make remarks and then have questions, please use the chat box to share the information with us. But Damir, can I ask you to present the results?
Yes. Thank you, Nick. Thank you, Pascal, for the update from the network. Thank you, Nick, for the introduction on the work that we're doing here and that we did previously. So as Nick mentioned, we started in 2019 already with a relatively large survey in the scope of the 2019 exchange program on the use of performance data and performance intelligence in hospitals. And then we thought about looking and exploring a bit wider, so beyond hospitals. So what happens to data outside of hospital before and after also it reaches hospitals. With the COVID and the situation, and of course hospitals being at the forefront of the fight against the COVID and the pandemic, we were very careful not to overburden you with a lot of surveying or interviewing, knowing about the workload that you're of course exposed to now. So we in the end did decide to do a very short survey. We call it a 1-minute survey. I think it had 5 questions in total, and we ran this survey between mid-January and 2 weeks ago or a week ago, mid-February. We invited exchange program participants from 2019 and those that were supposed to join in 2020 and hopefully will join next year. And we did receive 86 replies from 20 countries. And again, thank you for everyone who participated. Although it was a short survey, we really appreciate the time and the effort that you put into this, especially given the situation. So briefly, just on the kind of the demographics of the people that replied, 3/4 of replies were from participants that do work in hospitals that treat COVID patients, and that was maybe, I would say, our primary population of interest. And these are, as you can see, to a large extent, participants or people working in larger and university hospitals. Some in smaller and specialized. We also asked you a kind of a metaphorical question in a way. How do you see, or which of the images that we provided best describes how your hospital relates to other healthcare organizations in the system in terms of exchanging data on COVID? And we had these metaphors of islands and whether it's an isolated island, and that was very few replies. And then majority of people were somewhere between an island, which is connected to the land with a ferry boat, so not all the time, but still connected, and an island that is connected by a bridge to the land. So this was, I think, an interesting way of kind of conceptualizing how data flows between hospitals and other healthcare organizations in terms of COVID data currently. Then we asked you what happened during the pandemic with the collaboration of your hospital with other healthcare organizations. Has it stayed the same, increased, or decreased? And we see that it has significantly increased. So on a scale of 1 to 5, it is somewhere on a 4. So it has increased. And this is something that we also want to check, validate, and discuss during the panel. Then we asked another series of questions, and this was on to what extent does the hospital that you work in exchange COVID-related data with other types of healthcare organizations in the system. And we listed specifically public health institutions, which are, of course, hugely important during the pandemic, but then also long-term care institutions, primary care providers, and also other hospitals. And here we asked whether this data exchange happens never, ad hoc, so as needed, or does it happen daily or in real time? And here we see that most of the kind of daily or real time or closest to daily and real time data exchange between hospitals happens with the public health institutions, which is, I would say, sort of expected, but still a very interesting finding. And that the communication and data exchange with long-term care institutions, primary care providers, GPs, and other hospitals still happens more of on an ad hoc basis. So again, we thought this was an interesting finding. And as it was a super short survey, finally, we just asked you if you can, if you're willing or have the time to elaborate on any lessons learned during the pandemic in terms of exchanging COVID-related data. And we pointed out some positives and negatives here. Positives were, as we've seen also in these brief results, that the collaboration has increased and kind of the crisis was used as an opportunity for more collaboration interaction, which was often online, which was kind of a relatively new occurrence in some places. Also that it was a test for data systems, the existing ones and the ones that were developed purposefully for the pandemic. So also on testing and treatment and vaccination. Also that different aspects of data quality, including kind of its semantics and coding and what data means and technical capabilities of data were improved. And that in general links with other organizations and within the organizations and hospitals themselves have improved. Some of the negatives were that the pandemic kind of revealed more how the data is siloed and kept in separate places, not being connected, and some of the data governance issues. Also, some of the negatives was the one-directional sharing of data, which was mentioned as an issue. And one of the negatives kind of was the mention that the data production increased, but not in an organized way, and this data is then not optimally used for, again, care. And the neutrals, of course, some said that nothing has changed and that there's still a lot to learn, which I guess could be a positive also. Yeah, so that was it briefly, very briefly, the results of a very brief survey. Again, thank you for participating, and these were, I would say, hugely interesting results. I hope you find them interesting too. And I'll give the floor back to Nick to present our panelists and how the panel will work.
Thanks. Thank you very much, Damir, for sharing the results. Yes, and then it's a pleasure to me to present the panelists to you, who will be the first group to discuss the findings. We have a nice panel today. We have Jeva Lechnice from Latvia, and I hope I pronounced your name correctly. We have Jovan Regen from Ireland. We have Sofia Oliveira from Portugal, and we have Ton Roelofs from the Netherlands. And yeah, perhaps at random, I could start in Portugal and ask Sofia. Sofia, could you just reflect on the results that Damir just presented? Does that resonate with what you experience in Portugal, and especially what you experience in your hospital in Lisbon.
Hi, good morning, everyone. First of all, I would like to thank for the invitation in this being part of this webinar. Being the first is my first participation, because this year I'm the national coordinator of HOPE, so this is my first official participation. So thanks for the invitation once again. Related to the study, I think it reflects the way we feel also in Portugal and in our hospitals. I'm not a clinical manager, I'm a human resources manager, so my overall the way I see the overall data is more linked with my work, but in an overall, I think the results reflect a bit everything that we crossed, and it reflects also the COVID situation now, and how we share the data and how the data are recorded and reported also. So if I can start with some ideas that I have. For example, in terms of the way managers see the data and the collection, I think we started more to collect the data from the patients, and the way we see how the clinicals work. And the managers are, of course, treating that data and putting them for everyone to share. So yeah, I think it reflects a bit how we feel it. So I'm a bit nervous, I'm sorry. So, but I think, yes, it reflects in an overall.
Very good. Well, we'll go more in that later, but great you participate, and good to hear that yeah, it reflects your situation, that there is more cooperation, and that you get more transparency of clinical data as by managers. Can I go to Siobhan in Ireland? I'm also aware you're now in a different position, but could you explain a little bit the situation in Ireland with interconnectedness of hospitals with others, and with COVID, for example, the data on planning of capacity?
Sorry.
Good morning, everyone. Good morning. Like Sophia, I'm working my day job as a HR manager. During COVID, I was redeployed to support the COVID effort and working with the community testing teams in our region. So I think that there has been an improved exchange of data, excuse me, across mainly across our GP network with our hospitals, and an increased connection with pharmacies in order to allow you know, non-contact during COVID. So there has been a good exchange of data and a good system. We said there's a new health mail email system throughout all of the services now, which allows for that. So that certainly has improved since COVID, and it was something that was kind of sped up when COVID happened. So I think the COVID situation has identified some shortfalls, and I know that in Ireland we're working to implement the individual health identifier. So hopefully, you know, that can be progressed, because I think that's a vital way of sharing data across the systems. But I think the survey certainly reflects the Irish situation from my experience anyway.
That's very good to hear, and thank you for sharing the experience with the new initiatives with email exchange, with primary care and community care. Do you have also insight in data exchange on hospital capacity, or whether that was changed, that was shared between hospitals and used to make decisions, or suggest patients from COVID patients from one hospital to go to another, just to maximize the capacity?
Yes, at the moment our system is divided into hospital groups, and there's a good connection between the hospital group data and the national data. I suppose there's improvements underway to exchange data among the hospitals individually, but there is, you know, there has been a good exchange of data among hospitals, and we've also during the pandemic had more of an engagement with our private hospitals, and there's been a huge engagement from them, and obviously the exchange of data moving with the patients. So they had taken a lot of the strain from the public hospital system that was under pressure. So there has been a good exchange, I think, among the hospital data. So it's stretching that out beyond and into nursing homes, which obviously was a big concern in Ireland, I'm sure, as it was across Europe for COVID, where our nursing homes were seriously hit. So that email connectivity in terms of a GDPR compliant system of communication was also put in place there. But I think our interactions or our data exchange among some of our community providers are still where we need a bit more work. But certainly on the hospital data exchange, you know, I think we've certainly come a long way, and it was proven very effective, I think, in COVID.
No, thanks very much, and especially also your experience with starting sharing not just the data between the public hospitals, where I assume that there was already a system in place, but also start exchanging the data with the private hospitals. So was probably initiated partly because of the stress that the pandemic put on the hospital system.
Yeah, absolutely. Yeah, there's been great connectivity since. So hopefully that's something that we can build on.
Okay, that's good to hear. Let's go to the Netherlands, to Tonne Roelofs, also coordinator and based in a teaching hospital in Zwolle in the Netherlands. What are your impressions when you see these results, and could you link that to your experience in the Netherlands in Zwolle with changes in data exchange of the hospital with other parties outside? I think you're still on mute, Tom. I'm sorry, I can't hear you. Otherwise, let's ask Jeva first about the situation in Riga, and then try to come back to Tom to see whether he can sort out his microphone.
Yeah, hello to everyone. From Riga, I represent the university hospital, children's hospital, and also medical university. So like, I agree also on this data, because the situation has improved despite our starting point wasn't very good, as our national electronic health care system is very poor regarding functions, like it offers just very basic functions as prescriptions. Now also it's possible to see results of COVID test and also vaccination data. But despite all that, we had improved in three main blocks. Like, first of all, it was possible to see very clearly the reality without pink glasses, and it highlighted the real problems, and also made a clear vision how all parts involved would like to see the data exchange and integration process. So at least university, large hospitals think in the same way, and it's a huge step. So also, secondly, there was data exchange got some structure, but mostly information exchange, as COVID management demand to move very quickly, and then all the processes were were very detailed what kind of information, when, where need to be sent, shared. So it was also like some new way how like to start to work with data and data exchange. And thirdly, it promoted the innovations like regarding data. And I would like to share like briefly the two good projects. Like one is like a little one, like Children's Hospital wanted to implement online telemedicine consultation before COVID, but we faced with very issues from government side, from NHS, and regarding responsibility, etc. And then COVID came, and all issues were like resolved very quickly, and it was like clear requirements, what kind of data is needed to make this online consultation possible. And the second innovation was that Latvia became a first country that launched a COVID contact tracking app using the newly available exposure notification interfaces by Apple and Google. And it was also fully GDPR compliant. So yeah, more like definitely more like benefits and improvements. So yeah.
Oh, that's very encouraging to hear. So also in Latvia, the pandemic initiated better data exchange of your pediatric hospital with others. In Ireland, we heard that for the community it was an email setup. What kind of digital infrastructure? I know that's perhaps a technical question. But what digital infrastructure do you have in place to do that? So how do you improve the data exchange?
Like that, the biggest problem is that we don't have this like common infrastructure. So basically, each organization uses systems according to their level of knowledge or financial like capabilities. Starting from very like advanced IT system, like my pediatric hospital, in my opinion, we are having very good IT system, but in other like organization, still people use like WhatsApp, Excel, sending an email. So it's very like hard to manage everything that's because each organization is using something very, very different and sometimes like quite opposite. So basically, yeah, the infrastructure here is the biggest problem.
Yes, and for example, the reporting COVID cases, how is that practically organized?
Practically, when the COVID started and also till November, our country was in very good position. We have like very low like number of COVID. And then it was possible to track everything very carefully. An epidemiological center was like, for example, in my university, we need to report the data about students sick, and then we need also to track contact person. Now, when we are having the highest COVID number in Europe, so it's like it's a little bit messy, but everything is like tracked, everything is in a system, and like the data is in one common system. So at least maybe it's even Excel, but it's in one place, and so it's possible to follow up. That's like this situation, even it's old school, but it works.
Okay, but you say it's all in one system. What does it mean? If you have a case in your hospital, how do you report it? It's not electronically extracted from your records, so you probably have to report it in a system, and then it comes in an Excel file that is shared with everybody?
No, it's not with everybody. It's like common system with epidemiological and prevention disease center where they can see and they like then tell next steps what need to be done. And also then it's like family doctor need to get this information, and then like the general practitioner is making these follow-ups now. Before it was done by like in centralized way, but now it's like on general practitioner's shoulders. But like exactly about data, maybe I'm not able to give you like exact answer.
Oh, that's
just idea.
Yeah, that's what we hope later. It's very good to know that new things were initiated. You share the data, and even despite the fact that you don't have a very sophisticated ICT system nationally in place, you are able to share and ending up with one data system, which for the COVID patients, which is mainly then controlled by the Public Health Institute, I assume.
Yeah, exactly. And also now we are facing another issue regarding vaccination process. So basically there is that an electronic healthcare system, but it's not enough to manage it in an effective way. So we are now like building up something like individual again. So we'll see what will happen and how it will work.
Very good. Thanks very much. Let's try to go back to Tom.
Yes. I hope you can hear me.
Now we can hear you. This is
great. Fine.
Please.
I'm so sorry for it. I have tried it before, but at the moment it just didn't work. So good morning, everyone. And thank you for inviting me for be panelist. So what do you want to hear from me? The situation in the Netherlands?
No, we want to hear whether the results of the survey reflect, and a little bit about the situation in the Netherlands and Europe.
I recognize the situation of the results of the what we saw, and I think sometimes we are an island, sometimes there are ferry boats, and sometimes there are people are building bridges to share data, and to we've been learning from the first wave of COVID, and for example, using the intensive care beds in the Netherlands. Now there is more coordination in the Netherlands. We learned from the first wave of COVID, and so patients are spread among the whole country now, and we're using the beds more better than in the first wave. And so what I expect is that we are improving very quickly, and we are sharing data from a national way to see what is the number of vaccination, for example, what's the number of patients who are infected. And I think the national coordination is very good in this way. But there are a lot of issues, especially for sharing data between hospitals and between GPs and between home care organizations. So we're trying to share it, but sometimes it's very hard to share it by different systems we are using.
No, that's clear. That's recognizable what you're saying. Just a follow-up question on you say you exchange information about intensive care and intensive care capacity.
Yes.
You know how that is actually done. Because I know from the very beginning there were some initiatives to even distract the data from electronic health records, but that kind of stopped. And as far as I know, that they are now using a national registry to do it. But how does it go? Because you all of a sudden you need very timely information. You need on a day-to-day basis to know what the capacity is.
Yes, it's true, and so all the hospitals are connected. And there is a national coordination point in Rotterdam, and there they know what the number of intensive care beds is at this moment, and we can predict about what we expect the next week and the next 2 weeks by the number of infections and the number of intensive care beds we need. So in this way, all the hospitals take care of the COVID patients.
Yeah, but that's also an innovation, because before the pandemic it was very difficult to have data from all hospitals in a timely way about a key capacity like ICUs.
Mm-hmm.
Thanks very much. I propose that we now do the quick poll, because we have a series of questions which relate to what we just discussed. Basically, we would like to know from the participants what kind of data exchange system is used for communicating with these 4 parties that were in the survey. So you will be asked for how do you communicate with your public health institute? How do you communicate with your primary care system, with the long-term care facilities, and with the and with your colleague hospitals. And for each, we give you 4 options. And of course, these are a real simplification. But the first option is there is a shared electronic health record. So basically, there's open access to the records everywhere. So actually, the sharing is in the structure. The second option is that there are separate digitalized databases, but basically you have to go to a portal and there you add your data or you retrieve your data. The third is the option of an email system. So you use the email to send things around. And the fourth is to use the phone or the fax. So this is for all participants. You see now the poll in front of you. It has four questions for 4 of the type of interactions of a hospital with public health, long-term care, primary care, and other hospitals. And we just want you all to score, and basically give you 30 seconds now to do it. It should be quite obvious, but just to get a rough idea very quickly. What are the kind of data exchange mechanisms that at least the participants of this webinar use?
People are still voting, so let's give it a little bit more time. Half have now voted.
Yeah, I see that 14 out of 29 have voted.
Okay, half have voted. I'll show the results because it has stabilized now.
Okay, I'll just share the results and then go back to the panel. So on the question about information exchange between the hospital and a public health institute, well, you can see it yourself. We have roughly 1/3 shared electronic health records, 1/3 separate digitalized databases, and it's almost 1/3. If I go to the question, information exchange between your hospital and long-term care institutions, less shared electronic health records, and still half of the respondents say that they communicate via email. If we ask about the exchange of the hospital and primary care providers, we see 2 of you answer that there's a shared electronic health record, but then we see that it's really a mix. So we have separate digitalized databases, a portal, we have email exchange, and we have also several of you answering that the exchange is going by phone and by fax. And the fourth one is the information exchange between your hospital and other hospitals. Again, seems that majority of the respondents here are saying that it is going by email. Few people also still by phone and fax, and 29% here, but that's for people say separate digitalized databases. Thank you for for these responses. Again, this is not surely not representative, but it shows that with this group we are in different realities, and then different realities in terms of the maturity of the infrastructure in which your institute is functioning, and then in a way the infrastructure that could be used for exchanging data on COVID. Can I go back to the panel, and perhaps in this round go a little bit more in depth what you foresee that the changes will be in also in the coming time. So if you see what has been initiated, what would your hospital be working on? What kind of data exchange? And also when you look at these 4 parties, where would the emphasis be? Can I perhaps this time start with Latvia? Jeva, what you already explained, the projects that your pediatrics center was doing. What more do you foresee in the future?
Yeah, like as I told that at least our hospital is having like kind of strong IT support system, so we are able to do something more like comparing to other institutions. So we are actually building up something big like a pilot project in telemedicine, what consists of like multi-level like children's healthcare center. And I'm also partly responsible for that. And it will consist of information database of our diseases. Then it's like semi-automated at the level for patient, where they can see all data, contact like online remotely with their doctors. And then the 3rd level will be like for professional, where they will also able to exchange data, not only in our hospital, but outside in regions. So, and also for like second opinion, like with doctors abroad, but this is for like 2 years project, this level. Then also something for science, where will be this data pool, like plant and etc. So we are like a pilot, we are doing pilot project for our country from my children's hospital university side, and we are participating in a huge European project with 70 other countries, where we are like next adopters for these digital solutions from like original, like good example where those like digital solutions are working very good from in Spain and Germany, and we are like next adopter from this Denmark, South Denmark model, where they're having good digital solution systems. So this is something what we are working on.
So it's really on the agenda. There's a program for further digitalization. You
Yes.
different steps. And if you would compare how 2 years ago a general practitioner who would like to connect with your pediatric hospital, so the patient from a GP is in your hospital is treated, how was the data exchange before the pandemic? How is it now? And where do you want to go?
Like you mentioned, the very weak point in our healthcare system is general practitioners, because they're like kind of like inflexible regarding digital solutions. So like regarding general practitioner, nothing has changed a lot, but they are like at least exchanging information more than before in, like I mentioned, like WhatsApp or emails, but at least it's moving somewhere that they are exchanging data. In our like dream project, it will be that they will learn how to use our like pilot system, where they can see the data about their patient, what they're in their environment. And also it will be like our IT solution will be connected to huge like government electronic healthcare system. So yeah, that is in the dream, but we don't know how this problem will be solved, like regarding general practitioners, because that is like yeah, we are facing a lot of issues.
No, thank you. And you're not the only country where even you mentioned Denmark, where in their integrated data model, also the interchange with the GPs was yeah, quite, now it's better, but it was quite difficult to do. But it seems a relevant thing to ask, because I assume in a pediatric hospital that there would be children that are also seen by the GP. So you would assume that if there is a unified health record that different parties can use, that would be an optimal solution.
Yes, of course, because it's like that is why we are considering, and we are like making to think how we can involve in the best way possible, like general practitioner to participate in the program, because it's also in our interest to see what like the patient have what is the history in general practitioner, like when the patient is coming in emergency room, etc. So it will be in a great interest for both of parts, but we just need to find some solution.
No, thank you. And how's that in Ireland, Siobhan? What steps do you expect to be taken in the coming years to optimize the data infrastructure for interchange of the hospitals with the other actors?
Yeah, I think it has improved in Ireland in relation to the GPs. I mean, just from personal experience, I visited the GP yesterday, and electronically she referred me to a consultant there and then. She turned from her PC and said, "You're now referred, that's gone to that consultant." And previously that would have been done by letter and post, or possibly fax if it was urgent. But so the communication systems, there are several systems that the various GPs use, but we are now linking them electronically. So I think the individual health identifier is probably something that will pull all of those systems together, in terms of at least there'll be one individual identifier for everybody within Ireland, because at the moment, if you move from one service to another, we don't have anything to track or trace an individual. So that's something it started to be implemented, and I understand it was implemented for childhood immunization, starting from there, and a few other areas, but that's something where there's more work to be done. But I think our systems, in terms of like all of the hospital data, will be collated by our National Hospitals Office, and the public health data in relation to the numbers of cases in relation to COVID or any of the diseases that they record. Again, that's managed by the National Public Health Office. So that data exchange is pretty good and fairly reliable. So that's very good systems to record that. So I think it's expanding out and integrating with the other services, and as I mentioned, the likes of our nursing homes, whether they public or private nursing homes, to link with them and make the integrations with their systems better. So I think at least the electronic email has been a help, in terms of there's a secure GDPR proof system for communicating now, where that may have been done before by fax or other systems that weren't so secure. So certainly there have been great improvements, and I think some things have improved more rapidly because of COVID. There was sanction for a lot of those systems, and I suppose a lot of communication virtually. A lot of our, for example, our health and social care professionals are now, working remotely and doing online consultations, and a lot of the hospital consultants. So that has the technology has improved to allow that to happen as well. So that's been another, and obviously the data exchange in relation to that has improved. So I think certainly, COVID has highlighted the need for the better data exchange and for more efficient data exchange. And I think it certainly has maybe pushed on some projects that may have taken longer, but this seems to have the impetus behind them and has moved them on.
And then are you aware whether there will be emphasis on strengthening the data infrastructure in the coming years, also by your Department of Health?
Yes, there is a big push in relation to the whole IT side. I know that we're trying to implement a Health Ireland platform, which would be a platform at which every organization within the HSE, within the health service, are all on the one platform, which enables the safe data exchange. So that's being rolled out throughout the country as well. So that's another piece that will ensure the secure exchange, because at the moment so many of the system are on different platforms that don't necessarily talk to each other. Probably a little technical for me now, but so that process is underway in terms of trying to speed that up so that we can safely transmit and transfer data. So certainly I think that there's been more progress, and I think the digital transfer of data has been prioritized as a result of this.
Excellent, thank you. Back to the Netherlands. Ton, basically the
Yes.
same question. What do you see happening in improvements and just capitalizing on the changes that have been initiated in the past 9 months?
I think one of the lessons learned of the COVID is that data is very important, and sharing data is also very important. And it gives us a lot of improvement in the last months, a lot of initiatives to build about the care situation in our country. I think there are a lot of initiatives to share the vital measurements, for example, of patients in the home situation with the GP and the home care workers, and also the hospital. So I think in the future, sharing data is very important between all the participants of the care system. And it must be very easy, and it must be creating value. That's also important. You can get a lot of data, but you have to use the data. And sharing data is very important. I think we have to think. We have learned about the COVID that working together by sharing data is very it's next level, I think, for the care situation. And in the future, patients will stay at home, and we will look after them from out our hospital. And the patients will not go to the hospital, but we will take care of them from out our hospital. And we can see the data, and we can think about what's happening with the patients by collecting the data and discuss about the data with all the professionals.
No, that's good to hear, that future. And I'm aware of the time, but then I'd like to hear from Portugal. So, Sophia, what similar developments in Portugal, what we could expect in the...
I think so. I think especially COVID helped us mostly sharing information, not just inside the hospital and between services, but sharing the data because we needed to share it along the other hospitals, and helped the articulation between them. Because we had a higher level of COVID patients now, we needed to share all the information, and sometimes even with the sharing patients between hospitals, we had to share all the information also. So I think all this situation helped us, not just sharing new data, even with in terms of national, with the government, with all the national institutes, but with first of all with other hospitals, with not the primary care, but mostly the continuous care. Some patients, especially the elderly, we had to get some places to them. So we need to create all these data that we need to share with institutions too. So mostly we learned how to create new communication systems, and built and rebuilt some of the data that we already had. I don't think that the COVID will create, not in terms of the collection of the data, it not will it's not going to improve so much because we already had some good information, but it will help us in other ways, especially in the relationship that we create and that are very important also in the health system.
Thank you very much, and well, all the panelists for starting this discussion. And as we said at the beginning, this is a start. We hope to follow up. I hope you see the common ground. You see that you're all experiencing in a situation where you start strengthening the connectivity of your hospital with other healthcare providers, and that a lot has to do with data systems and what the infrastructure that you have already in place. We stop here, but we would like to continue this dialogue. So the plan is that with the group from Amsterdam, we will be contacting some of you, because basically we would like to have some case studies. We have some case studies from different countries where in the coming months through interviews we get a better idea, specifically where are you, what data systems do you use, what so that we can make the discussion even more sharper. Then we hope to have these case studies ready for a next webinar that we would like to host on June 11th. Thanks very much. I would give the floor for the last word to Pascal.
Yeah, thanks a lot, Nick, and thanks to the team in Amsterdam, thanks to the panels and the audience for being with us. It's very nice to see that the healthcare systems in Europe have been resilient, but also innovative, and there's a lot more to learn in the future. So as you understand, you will see more of us, and you will hear more of us in the future. Please take this date. We will send you together with a link to this meeting information by the webinar on the 11th of June. So we'll come back later on this. And of course, we will keep the contact with all of you, the national coordinators, of course, but also participants and hosts concerning the 2022 exchange program. So wishing you a nice day and then a nice weekend. Hoping to see you at least on the 11th of June. Bye-bye.
Bye-bye. Stay safe.